Hello, everyone. Welcome and thank you for joining us today for the Advanced Topics in IS webinar from Sapling to Redwood, Implementation Science Career Development Grant. My name is Stephanie and I will be your host. Before we move into the presentation today, I'd like to take a few minutes to read over some comments before we get started. All lines have been muted upon entry and will remain muted for the duration of the webinar. Questions are encouraged, and you can submit questions throughout the presentation in the Q&A or chat panel on the right-hand portion of your screen. From there, select all panelists from the drop-down. We will ask these questions on your behalf during the Q&A portion of the webinar, and you can find the different audio options under the communication option on the upper left-hand side menu of your screen. Should you need to view any live captioning, please refer to the media viewer panel on the right-hand side of your screen. This webinar is being recorded and it will be posted online in the near future. And now I'd like to turn it over to Dr. David Chambers, Deputy Director for the Implementation Science, part of the National Cancer Institute's Division of Cancer Control and Population Sciences.
Thanks, Stephanie, and thanks so much to everyone for joining us. If this is the first time that you've tuned into one of these sort of fireside chat webinars, the goal really is to try and foster discussion around a particular topic that we all feel like is of interest to our broader implementation science community. We very much appreciate those of you who've tuned in before and have submitted your suggestions for topics or things that we should cover on these webinars, and we're very happy to kick off sort of mini-series within these sort of fireside or campfire chats, depending on the weather. The next few months, including today, will really be focusing on the sort of grant development, submission, and review process. As we've been relaunching our program announcements, our NIH-wide program announcements for dissemination and implementation research, and we've been thinking about a range of other funding opportunities, we want to make sure that we're doing everything that we can to think about all types of grants. So not only the research project grants, the larger studies that we at the NIH and others are able to fund, but also importantly, those grants that are really centered around building the individual careers of investigators. And so we thought that this month would be a really great opportunity to learn from some of those who have come before, who have really set the tone for using career development awards to think about how to advance their careers, who are thinking about different aspects of implementation science, and who can give insight to us all as far as some of their journey along the way to thinking about how to best use career development awards, some of the mentoring and some of the specific goals that they've set out to do, something about their experience around review, and really lending advice or guidance around the things that you want to know. And so, as always, and as Stephanie had mentioned, we'd love to see your questions populating the Q&A field. As soon as you submit them, we'll have a chance to offer them to our expert folks who are participating with us. With that, you'll see the pictures of me on the left, and then the wonderful guests that we're able to invite today, Beth Burnside, Melinda Davis, and Sangini Sheth, who all have used career development award mechanisms to advance their career, and all of whom are pursuing work in the implementation science space. All of them also represent success from some of the ongoing training opportunities that we've been trying to provide in recent years. So Beth Burnside, I got to know through her participation in one of our tighter trainings, the Training Institute for Dissemination, Implementation, Research, and Health. I think it was the one in Pasadena, if I'm remembering correctly. Beth can correct me if I'm wrong. Melinda Davis, who I met through the mentored training, Dissemination, Implementation, Research, and Cancer. MT Dirk, which was an R25, a research education grant that was hosted for a number of years by Washington University St. Louis. And then Sangini, who I first met actually when I had the opportunity to go and visit and meet with some folks at Yale, but then saw again as part of our most recent TIDIRC, the Training Institute for Dissemination and Implementation Research in Cancer that we've held the last couple of years. We're so grateful to have the three of them on, and you see their impeccable credentials and the positions that they hold in the different institutions that they represent. But we wanted to start out really where we start often with these webinars, which is getting a sense from each of our guests how they first got interested in implementation science, and particularly as we're thinking about career development, how they identified this as a specific training goal that they wanted to pursue. So welcome, Beth and Melinda and Sangini. And why don't we start, we'll sort of flip it up in terms of the pictures that you see before you. Why don't we start with Melinda and then Sangini and then Beth in talking a little bit about how each of you first became interested in implementation science and how you were thinking about training yourself up on the content area. So Melinda, you want to kick us off?
Yeah, I'd love to. So I actually think I like that image too. I first got interested in implementation science around 2009. And at that time, I was working as a practice facilitator for a practice-based research network. And what that basically means is I was working with clinical partners and community partners to implement evidence into practice. And we talked a lot about translational research, but it wasn't until I think I got an email about the Tidier training that I'd ever even heard of implementation science. And at that time, it kind of struck me as a really important way to think about not only what are we doing in terms of the actual work of implementation, but how do we study to figure out what intervention should we be using based on setting context, what are the best ways to support kind of intervention adoption in a setting, and how do we move from beyond the actual act of implementing to the study of implementation. I think the thing that's interesting about that and kind of funny and embarrassing is, David, I strategically don't remind you of this, but in about 2012, we had a conversation when you were still with NIMH about a career development award I was exploring at that time. And I remember, because our conversation, it was sort of like we were speaking different languages, because I was very much still steeped in the act of implementation, not the language of implementation science. And I remember coming away from that conversation really thinking about how much I still had to learn about this new language that I think was really critical for my overarching goals in terms of how to improve rural healthcare. So I got interested because I saw this as an opportunity, but I understood I didn't have the lexicon in order to even participate in the discussion at a high level at that point in time.
So thanks for giving us a stroll down memory lane. Yeah, I mean, I think it is an interesting challenge where sometimes when we think about how do we just make sense of the terminology, the concepts, and how do we position our own careers so that we're able to pursue what we find most passionate, but also make sure that we don't have sort of blocks along the way. So I certainly remain hopeful that I was not a roadblock in that process.
You were very kind. You were very gentle.
Well, thank you. Sangini, I think we need to unmute you. Yeah, there we go. Okay, can you, same question?
Yeah, of course. So I think I maybe backed my way into the implementation science realm. A few years ago at my institution, some of the more senior folks taught almost like an introduction to implementation science, 5-lecture module, and I took it, and I realized that what they were speaking about was very much where my interests were. So I kind of clinically and from a research standpoint, in this area of cervical cancer prevention and screening, I live in an area that has a lot of evidence and a lot of guidelines, and this message of, closing the gap, of getting that to a broader population and to greater adoption, really spoke to me, and it was really nice to realize that there was this whole field of science that could provide, rigor and methodology to kind of guide the way and guide the research side of that. And so that's how I kind of came into this space.
Great, thanks. And Beth?
So my story is a little longer, being one of the senior colleagues that maybe Sangini was referring to early in her comments. So I came naturally to the conclusion that implementation science was something that was hugely important and to get training in it as I went along my career, which started in terms of career development awards in 2006 when I got a KO7 from the NCI. And as a radiologist and as an individual with some background in informatics as well, I was really interested in decision support, even doing machine learning and artificial intelligence to try to understand how we could better do risk prediction. That was a wonderful experience. The KO7 was great, and I can talk a little bit about generically the persistence that it requires to get those career development awards. There's so much to learn in writing those, et cetera. But as my career continued, I realized it's great to innovate in this space, but we're never going to get these models to patients unless we really understand implementation science. So even a little later in my career, not as a sort of assistant professor, I had to go back and say this body of science that's growing, this implementation science discipline that really was, very nascent in 2006 during my assistant professor years and my K award. I really had the motivation to go back because I wanted to bring this these models, this new era of big data, some of this machine learning to the clinic. And so I got a K24 in order to do sort of mid-career learning, and it involved both mentoring and career development for me to learn about implementation science. And so I think TIDER, which you mentioned, David, was instrumental in that development, and it was in Pasadena. It was lovely. So I think that's the reason I got so interested. It was out of necessity to get this science to our patients.
Great. And so, Beth, you kind of kicked off a bit of a discussion that we wanted to have. I think it might be interesting for all of us to get a sense for, how each of you made that decision that the Career Development Award specifically was the mechanism that you wanted to employ to try and advance your knowledge in the area, and how you thought about the specific goals that you set out to try and accomplish within that grant. Beth, maybe I'll start with you just to see, is there anything else on top of what you've already said that you'd want to add in terms of, why Career Development Awards, and then, move back to Sangini and Melinda to flesh out their own experiences of why the Ks as a potential mechanism?
Sure, I'm happy to start. When I came out of residency and fellowship, and I also had this master's, I had an MPH and a master's in biomedical informatics, I realized that so much of the innovation that was going to happen in the space was interdisciplinary. So even though I had 2 master's degrees, it felt like I hadn't gone deep enough in some of the areas that were complementary to the radiology, for example, the computer science and the decision analysis and some of the evaluative techniques. So the career development, the KO7 that I got as an assistant professor was so crucial in developing sort of depth in those other areas that made me credible in this interdisciplinary space. So I think K awards are so valuable. It's sometimes I think when individuals come out highly trained, it's hard to convince reviewers that you need even more training. And that was a struggle I had, and we might want to spend a little more time on that in terms of strategy. And then I'll just add, being able to have that time of career development as an assistant professor, I continued to scour the the NCI website and other institutes' websites for training opportunities. So I think once you've had a K award, you realize how instrumental lifelong learning is, and that's why I think the K24 was so attractive. And I think we can always have that in mind, that training opportunities as we go along, the technologies and the techniques and methodologies change so much in a career that it has to be kind of a continuous pursuit.
Thanks. Sangini, how did you settle upon the Career Development Award?
That certainly resonates. And I think for me also, I'm a generalist clinician by training, so I, didn't have the additional time during fellowship that often is dedicated towards research. So although I have my MPH, I definitely felt like I needed to steep myself in more rigorous research training, and the protected time that's come with it has, the didactic and learning time I've had, and especially specific to implementation science, because it is a newer area, and so I'm fortunate to have a few people where I'm at that, that are more senior and have training, but, there aren't a lot of people. And so I think that became even more important to be able to carve out the time to do that.
Mm-hmm. And Melinda?
Yeah, I would echo what Beth and Sangini have said. So I first got interested in a career development award in 2012, which was about 2 years after I had started in a faculty position. And I'm at an academic health center as a PhD, and it's very much a soft money environment. And I really started out as a participatory researcher with expertise in rural healthcare disparities, but realized that in order to advance kind of on an academic trajectory, I needed to kind of start building my own independent area of research and research niche. And I really saw the Career Development Award as the opportunity to make space for that. I think it's really important to note, kind of like Beth said, I applied for multiple years before securing a K award. And I think that process of applying was really important. And throughout all of those applications, implementation science was built in as a training aim. But as my understanding of the field advanced, I was also able to go deeper in terms of what my goals were for the training aims around implementation science. So I was really just interested in doing it because it provided this opportunity to make space and time for detailed thinking about a topic area that my partners had identified, which was really interventions to increase colorectal cancer screening in rural settings. So it provided the space needed to move from kind of a generalist and somebody who had broad knowledge to really somebody who had deep knowledge and expertise on the topic.
Great. Wanted to take a pause and just thank, we already have folks who are submitting questions, and of course we want to encourage you to keep them coming. Just so I can take on the first one, which I think is probably more of a question for me, so you can all take a pause. One of the folks listening in wants to know on the website that we have at the NCI, there are funding announcements that are listed, and they're mainly R mechanisms, R01s, R03s, R21s, and the question being, are there implementation science specific career development awards, K awards, or other types of things? And great question, and I think this is another reason why it's really helpful to see not just any one institute's offerings, but things that pop up in, at least for our agency, in the NIH guide overall. We at the NCI don't have specific K awards that are for any given area of science, although our career development awards in general are open across the portfolio that NCI sees. But some institutes at various points have different K mechanisms that they've been able to support. So some folks, I think, listening in are I can see from the names, have been involved in a recent NHLBI K-12 announcement, which is more of a sort of institutional career development award. But it's always good to keep an eye out for the range of different opportunities, and feel free to connect with program staff at whatever point is relevant for you as you're thinking about these different things. So again, thanks for the question, and keep them coming, and we'll weave them in as they come in. So we wanted to, I think mentorship is often something that can be challenging for folks to consider, the identification of a mentor and how to navigate that appropriate sort of not just individual mentor, but kind of mentoring team. And I wonder if we could hear from each of you, and let's pick the order, Sangini, and then Beth, and then Melinda. Why not? If each of you could talk a little bit about how you identified mentors who could support your training efforts and how you got them, sort of negotiated to have them sign on to play a specific role on the grant.
Yeah, absolutely. I would say this is probably one of my more favorite parts about implementation science is the breadth from which mentorship can come from, because it's so interdisciplinary. I had been in my faculty position for a few years before I applied for my Career Development Award, and I had actually been on an institutional K, and so those things, the time and that prior experience had given me some time to develop relationships. And so my primary mentors, one comes from the topical field that I'm involved in, and then the other comes more from, the implementation science world. And he happens to be someone who's working in cancer prevention, but it's not specifically geared towards cervical cancer. And then, I have a, kind of a committee of other people that I can go to for more specific things. But I would say that those all came with just developing relationships and with time.
Great. Beth?
So yeah, I think Sangini's assessment is very similar to mine. I feel very fortunate to be involved in this area because the community is very curious and very collaborative. So initially, my science has been very interdisciplinary, and so bringing together computer scientists and with clinicians and engineers, it's been super cool. And one of the things that I think has always helped with attracting mentors is the opportunity that they have to work in a new space. And as a clinician, I think it's always helpful when we say, hey, we've got great data that we can help, you try your algorithms on, or you can test your methodology. So I think really being willing to work in interdisciplinary spaces can help with attracting mentors. And I think in particular with implementation science, as I got toward my K-24, I got to work with amazing individuals in the implementation science space, and they're always interested in generalizing their methods to another domain. Just like Sangini said, they might not be familiar with cervical cancer, but they've been working on their methods in different areas, and that also attracts mentors. So I think that being really open to this interdisciplinary type of collaboration is something that really helps build a community around a mentee.
Great. And Melinda?
Yeah, I would just extend on that a little bit more. I think like Sangini, I also had an institutional K-12, and so was able to kind of initiate relationships at that point in time, that then I was able to really shift and complement as I applied for the NCI K-07. I think the other thing I got more strategic with over time is, as I refine my training aims and my research aims, really understanding how I could optimize the influence of my mentors by making it a little more streamlined, so they were actually helping with the areas they were most interested in too. Mm-hmm. And I think that's relevant because when I was first starting to engage partners, I think I felt very much like I was asking people for favors. And now as I'm starting to provide mentorship on my own, it's really shifting the way I view this relationship, because if there is a good match and, if there is a new innovative area that somebody's exploring, it's really exciting as a mentor to be able to participate and to help cultivate that interest. So I think if I have any guidance now, it's don't be afraid to approach people, because ideally it's a win-win relationship for both of you. Yeah.
No, that's great. And again, seeing the questions come in, I think we'll stick with the mentoring topic, and I'll just start offering some questions to anyone who wants to jump in. And so first question being, how critical did any of you find it was for the mentors to come from your home institution versus off-site? Anyone want to take that?
I can jump in on this one, because I think for my institutional K-12, the mentors were definitely, my primary mentor was at my own institution, and some of the collaborators were from external programs who had expertise in the intervention I was interested in or in implementation science. And for my K award, the primary mentor shifted to somebody from another institution, but I still had kind of co-mentors from my home institution. I think what's important is that you make the case for why that relationship and why that structure is feasible and can be productive. And I think you can do that by demonstrating that you have a history of publication together, and that you have a history of meeting together and having kind of productive exchanges. So I think, it's probably an easier sell if your primary mentor is from your home institution, but I think there are always exceptions or situations where you can still make a compelling case in your application for why it's feasible to have external mentors.
Anyone else want to jump in?
I can jump in.
Go ahead, Sangini. Go ahead.
Maybe a slight variation on that, in that neither of my primary mentors is in my department. And when I think I first started, putting together my thoughts on, my K application, I was hesitant about that and thought that maybe looked down upon or a disadvantage. And I think similar to what I think it was Melinda was saying, I made a strong case for it, and again, I think in this implementation science space, there's probably more room for that because of the interdisciplinary, component.
I might just add a little bit of strategy on that great advice that the other two panelists have offered. One is that if you are moving institutions, for example, oftentimes training happens at one institution and then you move to your assistant professor at a new institution. Some of your preliminary data might have been at your previous institution, and that happened to me. So in my K07, I was very intentional about trying to create bridges between mentors. So if I had a mentor in decision analysis at my prior institution, I wanted to take advantage of the network, but try to build bridges toward having mentors at the organization I was. So I think it's advantageous to utilize the mentors that exist at your home institution, because reviewers will notice that if there's a very prominent individual in an area at your own institution that you're not utilizing, then that might be a lost opportunity. So I think it's a nice strategy to take advantage of the network in a discipline if you are moving institutions.
Yeah, so a couple of additional questions that have popped up that I'm going to sort of fuse together because I think they're on the similar line. And so one of them asks, is the most appropriate mentor the one who's experienced in dissemination and implementation? And then related to that, that if somebody feels like they haven't really found someone at their home institution who has that label implementation scientist per se, whether any of you have any tips on how to identify these mentors, even though they may not specifically identify themselves with this field necessarily. Any experience with that, or suggestions come to mind for folks who are trying to figure out how do I bring in somebody who would be expert, but what if they're using different labels or are sort of not obviously identified to me?
I can sort of contribute an idea. I think some of the training offered by the NCI, like TIDER or the mentor training for dissemination and implementation in cancer, can help get you more familiar with other labels that might exist. It takes time to get into those, but those opportunities, I think, really helped me learn about the landscape and understand where that expertise might live. I think other areas at an institution where you can look for these opportunities are like in K-12s. Oftentimes there's a mentor network, and if there's any formal mentoring available at your organization, your institution, they often can help you figure out what mentors might be available in certain areas. So I think those are some generic kinds of tips and tricks.
Mm-hmm.
Anyone want to chime in as well?
Yeah, I was just going to say, I think the question about who the most appropriate mentor is in some ways depends on how you spin your story and your aims for the application. And by that, I mean, I think there's a lot of combinations that you could lead with that might be more or less effective depending on what mentors you have available to you and what your goals are. So I don't think it's a yes or no answer. I think it's definitely something that you should consider. How does the whole package align, and how do I put the strongest proposal forward? I think the other thing in relation to people who might be doing implementation science type work or have those skills, I think people who tend to do evaluation or system science or health services research, often they are maybe at the margin of implementation science, so they might be using similar methodologies but not yet using that same language. So it might be good to look at those partners too, so you could have somebody at your institution who brings expertise in the methods or areas you're interested in learning more about, but maybe you find an external partner who really has the, you know, the gold card as an implementation scientist. And I love what Beth said about the training programs. I think that's a really wonderful way to figure out who are the leaders in the field, either by doing the formal training, or I think there's an increasing number of pre-conferences around implementation science at some of the national meetings. So looking at those could be a good way to start making connections too.
I guess one other thing I thought about, cued by that last great comment, was, you know, translational research is also another buzzword that's very closely related to implementation science and dissemination implementation. So, you know, if you're at an organization that has a CTSA, that is a really good resource for both mentors and for an understanding of what work's being done in dissemination and implementation.
Yeah. And I would add, based on the earlier question about training mechanisms, I think looking at the CTSA and if they have any internal K awards, or I know some institutions have an ARC learning healthcare system, K-12 right now. That's another really good mechanism if you're lucky enough to be at an institution with those programs.
Yeah, and you know, kind of thinking more broadly to add to some of the areas that Melinda mentioned, you know, sometimes the quality improvement world, but as well also, you know, some cost effectiveness, you know, research also dovetails with implementation science as a methodology. Qualitative, you know, research is used, you know, often in implementation science. So those may be additional ways to kind of piece together, you know, the right team of people.
Great. So one additional question, then I want to move on to hear a little bit more about each of your experiences in trying to write up these difficult grants to try and write. And it again relates to the selecting mentors. And the question really asks whether how you balance the idea of I guess enlisting mentors that you've worked with before with new mentors, and the recognition that it's going to depend, of course, based on your research and the directions that you're moving into, but wanted to know if you had any tips on creating that good balance between the sort of older or more established relationships that you have versus breaking new ground with mentorship, and how that might be, in your experience, seen by those who are reviewing these things. Does anyone want to jump in on that one, that balancing question of sort of experienced or, known and unknown mentors?
I mean, I can jump in. I can say I remember struggling with this, and in various iterations of different submissions, kind of trying to frame that I was going with a newer mentor because I have an established relationship and a history of productive publications with one of my co-mentors, but this new mentor allows me to go in a newer area. In the K that got funded, the mentor was actually one I had worked with on my K-12, but as a co-mentor who is now shifting into a primary mentor role. I think, though, my answer is I wouldn't fret about this part of the application. I would put the best case forward you can and see how it plays in review, because the review it's not a crapshoot, but it's really interesting. Some people will love that you have an established relationship, and some people will see that as a weakness. And so I think, there are some things that you don't fret about. Just take the best step that you can forward and kind of see how it plays in review.
I would totally agree with that. I think the one thing that helped me not overthink this was to think of my mentors as a team. Mm-hmm. And so you really have to put a team together that's compelling around your science. And by looking at it as a team, it was less high stakes as to whether one had one thing or one had another, because in some ways, by thinking of it as a more holistic mentoring team, it made it more flexible to make a good case for why one person was contributing this, maybe an established relationship, and one mentor was contributing some more innovation in the direction. So I think that also helped me.
Yeah, and I'll just add pragmatically, I think having a funded example of a K and looking at how they frame that, I'm looking at mine and I have a table that highlights these are the training areas I wanted to develop, and then with that mentoring team, here's what each mentor brings to the table. So I think getting examples of successful applications can help you think about how others have made that pitch as well.
That is so true.
Yeah, I can't stress enough that point about, having the opportunity to look at other successfully funded cases, even if they're not necessarily, in implementation science. Some of it is just picking up, stylistically how other people have communicated information succinctly and clearly can be so helpful.
So given that each of you can look at your own past applications as successes in getting funded, we were hoping that you might be able to share some of the challenges and some of the sort of insights, the lessons learned through that process of trying to write these things that would be helpful for others to learn from. Maybe Sangini and then Melinda and then Beth can give us just your experience in trying to write these things together, and what stands out either as the challenges that you really needed to overcome or the epiphanies that you had that you think others who might be following this path could benefit from.
I think it has to be really, I'd be reminded, it has to be reinforced to me that, this is ultimately a career development award. And so the career development portion of this is critical. So it doesn't, this application is not solely about the research element of it. And, getting back to some of the conversations we had earlier, really highlighting, what additional training it is that you need and why it is that you need that. We spent a bunch of time talking about what the mentors bring to that. I think, and I wrote that part first which I feel like that was really helpful to kind of keep myself grounded as to what the end goal of this was.
Mm-hmm. Mm-hmm. Yeah, I think just to add to that, I think one of the things that's hard is this is really intimidating for, I think, a lot of people. This could be one of your first grants, and not only is it a research grant, it's the career development. I need to know what I'm supposedly doing for the next, 5, 10, 15 years of my life. And I think maybe some of the goal is to take the pressure off, right? This is your next best guess about where you're going and what steps you need to get there. So I think thinking of this and trying to reframe it as practice, and the fact that writing a career development award is going to help you get better at writing grants generally. It's also going to make you answer some challenging questions about what you really want to prioritize. I think when I first started writing Ks, I wanted to tackle everything, and I was trying to bring in all elements of my story about how I got to where I want to go. And I think over time, you get better at refining that and realizing you're multidimensional, but for this application, you might highlight certain key areas to help you get to that next step. I think the other thing, and this was something that a colleague in the mentor training and dissemination and implementation research shared, which I think actually took the pressure off a little bit for me just in general in terms of grant writing. And that's really the way he approached it is you're writing the grant the first time to get everything down, everything on paper, to get all your pieces together. And then your goal is really to get funded in that second cycle. And so some of this is just figuring out what tricks work for you to take the pressure off maybe the act of writing and make it more approachable. So I found that taking that pressure off and reframing it as, the first try is really making it easier so that you can refine it and make it shine that second time around. That was really helpful for me.
Mm-hmm.
I think those comments are so wise. I guess I would love to add the fact that, David, I think it's funny that you said, now that you have a successful application, well, I have plenty of unsuccessful applications that I also can look at, which is how it is for all of us. We learn so much from, failure in air quotes. It's not failure. I loved what Melinda said. Every grant review is so instructive. But I would encourage people to not try to write grants in isolation. Really, one of my best tools, I think, is sort of my fire drill deadlines, where I set a deadline that's too ambitious for me, but it's a deadline for one of my mentors to read the career development plan, or it's a deadline for me to finish my specific aims page and make it really good so I can run it by 1 or 2 reviewers at my own institution. So participating in mock reviews and really doing grant writing seminars when you're halfway through a grant and you're going to really internalize the pointers that are being discussed, rather than just going and sort of sitting in the back and theoretically thinking about your grant. I think really making it a multi-step process where you're refining it with lots of feedback is something that I think will get you there. As Melinda was saying, in that second round, the first round is always going to be challenging because you haven't yet had sort of study section experience. So I do think just setting up deadlines that aren't the real deadline to get you some feedback can be really invaluable.
Great. Thanks to all of you. Now, there was a question that was specifically Melinda asking if you could drill in a little bit on your preliminary studies that supported your K Award. And the question asks, how did you show that implementation science was a logical training goal with a CBPR background? So can you talk a little bit about how you integrated implementation science and CBPR together?
Yeah. So I'm looking at my application, and there's a figure that has kind of that summary of my pathway from my PhD training to research independence and how this K07 will fill that critical gap. And I think this is this is about how you craft your story. Like in my mind, implementation science is a natural complement to community-based participatory research in that, often in CBPR, you're working with partners to identify areas of need. And implementation science really gives you the ability to look for what are the right evidence-based interventions, and then how can we integrate them into these settings. And so I was lucky enough when I got my institutional K-12, it was a patient-centered outcomes research K-12. And so it was really easy to say how my expertise in CBPR positions me to understand how to engage with patients and stakeholder partners. But now what I need is like more rigor in the science. In particular, I need more expertise in quantitative methods to flush out what I already know about participatory research and qualitative methods in order to get to my longer term goal of leading these mixed methods teams doing pragmatic clinical trials. So again, I think it's thinking about what you bring to the table, maybe what you're hoping to gain, and then trying to build coherence and also not tackling too much. I mean, I think, again, when you first start writing these awards, you might want to throw everything in the kitchen sink in terms of your training goals. And so I think refining to make the case for what's the next logical step forward is one. And that's really where your mentors can help you. They can help you move from the complexity of all you know to kind of what needs to be shared on paper.
Mm-hmm. Yeah, really helpful. So each of you, I think at times has alluded to, of course, trying to write with anticipation for what reviewers might be thinking about, and wanted to hear from each of you what your experience was seeing these precious applications get reviewed, and if there were any sort of, now a few years later, a few strengths and weaknesses that you recall being identified by reviewers and how you digested those. So maybe if we can start with Sangini and then Beth and then Melinda, just sharing your experience going through the review.
Yeah, I would say that I think I'll start with some of the weaknesses were, more just my own personal, background in terms of what I had, accomplished to date or, publications to date. And, unfortunately, unlike other grant reviews, there's not really a mechanism to, aside from, resubmitting, to respond back to those critiques. So, I think and before the webinar started, I think some of us were commenting that, to just use these as opportunities to grow and develop. And then in terms of strengths, I come from an institution, I think, where I was fortunate to have other people who've done implementation science and that institutional strength, and then for them to run with that.
Mm-hmm.
So I found it really interesting to go back through some of my early reviews because it did remind me of some global challenges with K awards and specifically. So, and one was that I think Sangini alluded to this too. In generally, the reviewers are always going to respond to the candidate, and that's always sometimes the hardest feedback to think about. But I think one of the things that individuals might tend to do is be kind of modest, And so I look back to some of the reviews, and I find that I didn't do as good a job on my biosketch as I probably should have in my early submissions. And I'm from the Midwest, so might have a tendency to minimize some of the maybe national. So I just would encourage people to not be modest. That was one universal thing that I found in my early reviews. For K awards, there's always a desire to have lots of specifics about the mentoring relationship. So I think that that's something that people have to be cognizant about. It's really good to have specifics about how often you're going to meet with mentors and what exactly is going to be discussed. I found that in quite a few of my early reviews. And then one other thing I'll add that's a little just on a different topic is one thing I think that really helped me so very much was early reviewing on study sections. When you're junior and you're concentrating on your own science, you don't want to do too many reviews, but being an ad hoc reviewer on a study section, I think really helped me understand the nuts and bolts of review. It's a little different for K awards, but even if you're on an R01 study section, you see the interplay between reviewers and the grant submissions, and I found that, I think, immensely helpful for any grant submission that I ever did.
Yeah, I would definitely echo that. If you have a chance to serve on a review panel, it's really beneficial. And I think the first panel I sat on, I just kept a bulleted list of like advice to myself, like use the same terminology, use tables as much as you can. Like it's amazing to have that perspective. I think in terms of my kind of K journey, what's really interesting is in my early applications, I think a lot of the feedback was around, we're not sure if that candidate is ready for a K. They don't have they talk about your publications. They maybe talk about your prior, like your role, what your title is in an organization. On the K that was funded, it was a resubmission. It was funded on the resubmission, and the review in 2016, the candidate comments were like, this applicant might be too strong. Like, why are they applying directly for an R01? And so it's, this really interesting process of like Beth is saying, being really talking up your merits, but also being really clear and explicit about why this additional training was needed. And I think, what's relevant to say is that my first K07 submission wasn't actually reviewed, or it wasn't discussed, I got the feedback from the 3 reviewers, but no overall summary statement. And I think that's where your research skills can come in really handy, because you can read those statements, take some time away, and then kind of come back. And I did a thematic analysis so I could see what are the areas that were of concern and how can I address those in a way so that in my 1-page cover letter, I can really nail down that I've addressed all of these comments. And the ones in relation to the candidate were really around framing the need. And so, putting on my grantsmanship hat, which I was submitting a K07, but I was also submitting a PCORI application in the same cycle. And so you have to articulate kind of your expertise in different ways. For training goals, really refining terminology. And then one that I think is really important is in the research plan, I tended to use we because I really value being part of a team, but I needed to change that to I because the reviewers were concerned, how much is this your work versus the larger project team's work. So I think the message is keep trying, yeah, keep trying.
Yes, persistence, it sounds like in each of your cases has certainly been rewarded. And so hopefully for those who are listening, the same kind of thing will happen. Also, certainly as people are digesting their reviews and thinking about the application, the extent to which you want to reach out to the program contacts at the different institutes, because they'll be sitting through a lot of the reviews. They can sometimes give a little bit more depth to what ends up being a bulleted comment within a number of pages of comments on the sort of strength and weakness side. So recognizing that we only have a few more minutes left, wanted to take one question and also sort of fuel it into a more general one. And so, the reflections, as you were going through these processes, talking a little bit about this implementation science training and what activities best supported your growth, with an eye toward just more general advice that you might have for early career investigators who are contemplating a career in implementation science. So maybe if we could kind of pull those two together. And again, thanks to everybody who submitted these questions, that they've really driven the discussion in a way that is even better than we could have foreseen. So with that in mind, maybe Beth and then Melinda and then Sangini giving us your sense of both what activities stand out as being most meaningful and any other advice you have for folks who are following in your footsteps.
I have to say, I think the participating in TIDER was really instrumental for me. It again, to me, implementation science is so fast developing, and there's a huge body of knowledge already, but it's just accelerating so quickly. Having that moment to really be steeped in the cutting edge of implementation science and doing the networking was just immensely helpful, and I highly recommend it, and I hope that we can offer that training to more people, because I think, I think there's certainly limitations in resources, but it's so impactful. And then advice would be to take that experience that you get in whatever training you are able to avail yourself of, and then bring it back to your own institution and really develop communities at your own institution around implementation science. As we said earlier, there are lots of different names for people working in this area or peripherally in this area, and if we can all create communities at our own organizations around this important area, I think it's going to help us all.
Great. Melinda?
I would echo that. I participated in the MTDIRC, or the Mentor Training in Dissemination and Implementation Research, and that made me feel so much more comfortable, because you realize how kind the people are who are working in this field, and you also realize that we don't know all the answers yet. So if you're scratching your head, it might not be that you can find the answer in the research literature, but that's actually an opportunity to look forward to contribute. And then the Cancer Prevention and Control Research Network, that was also another group I got connected with during my K-12 that was doing work in terms of adopting evidence-based practice and D&I, and just wonderful to start building those peer relationships. So I would, like Beth said, I would really encourage you to start not just fostering mentors, but finding your peers. Like, find those best friends that are going to be your long-term collaborators over the next few years.
So, unfortunately, I'm not original here anymore, but I have to agree. The TIDER program that I have participated in, which I participated in while on my K award, has been incredibly helpful. The depths of those courses are really tremendous. They are competitive processes, so I think ways to access some of that information are, there are other ways to do that, while you're going through the process of, applying to these kinds of programs. There are a couple of different implementation science, listservs that, you can kind of keep up with some of the literature. I'll put a plug out for the 2 textbooks that, are out there for dissemination, implementation, research and health, and then the new one, David, that you were involved in, specific to cancer. I think those are both also great resources. If you're just kind of getting into the field. And then, specific to kind of career development awards, I'm a huge proponent of not reinventing the wheel, and, and asking for help, whether it's help from mentors, help from other people who have written and, had Ks funded, especially if there are other people within your own institution. If you're at a place where there's a CTSA, asking the CTSA for help. And not having to go about this, all from scratch.
Yeah, thanks for that. And also just a nice segue in that for people who haven't been able to attend the in-person TIDERC or TIDER training, on our website just within the last week or so, we've made available all of the materials for TIDERC as an open access format. And so anybody who at least wants to digest the materials that Sangini has gone through and have evolved over the few years that started out with the tighter training. Please do take those, because we recognize that there's often limited chairs in any particular room, and we don't want that to be the reason why people can't get oriented and begin in this field. With that, and seeing that we're 1 minute past the hour, I wanted to thank all three of you for joining, and thanks to all those who tuned in and asked such wonderful questions. I'm going to turn it back to Stephanie, who will close us out.
Thank you, David. So I want to be respectful of everyone's time. I know we are just a little bit over the hour. As I mentioned earlier, the presentation is going to be posted online in the very near future, so please check back for that. And please consider joining us on October 30th for our next Implementation Science webinar. And lastly, a survey will be open at the end of this presentation, so if you could all just please take the time to respond so that we can continue to improve our webinars that we offer to everyone. So thank you again, everyone, for your participation, and have a great day.
Okay, take care, everyone. Bye.